I think the technology of genomic profiling has really advanced ahead of our ability to fully utilize it. However, I think this is a real opportunity for patients because right now our classification of cancer is completely dependent on anatomy, where the lump arises, and histology, what it looks like under the microscope. The more information we get on really what drives the growth of each individual cancer makes us really to drive better classification of cancer and really allow opportunities for patients to get novel treatments directed against the underlying causes as opposed to just anatomy and histology. I think, in a variety of solid tumors now, it's been clear that cancers which before had been refractory to chemotherapy, like lung cancer, melanomas, due to genomic sequencing have really opened up new therapeutic avenues that have really changed the natural history of these cancers in a way I would not have imagined 10 years ago. And I think we're just on the tip. I think as we learn more and get more tools to intervene, more drugs, I think more and more solid tumors that were previously considered untreatable will become more and more treatable. The interesting thing is that, tumors that look identical under the microscope may actually have a broad spectrum of underlying alterations, and a small panel may not capture everything. So there are many alterations that are each individually present at low frequency, but in some actually represent a significant fraction of these cancers. And that's why, in certain circumstances, a broad panel is appropriate to try and capture all potential alterations. Actually, I assume in the future that almost every cancer type is going to have genomic profiling as part of its classification. But right now, it's really advanced well in lung cancer, melanoma, but I think inroads are starting to be made in other cancers as well, including breast cancer and colon and others. But there are cancers that are still quite difficult to understand, and new sequencing technologies and methodologies need to be developed. So where will this go? I have to tell my daughter where to look for this.
Yeah.